Hi everybody, welcome to this week's edition of Grace Talks. It's a dreary Monday afternoon here in North Carolina, but I'm excited to be here talking to you today from Hickory, and we're going to be talking about some threads today. I think we've had a few questions from some of our patients and other people regarding thread lifts, and Lori's going to ask me the question today about what people are wanting to know about them.
Yes, Grace. One of the questions that we received was, what are the differences between the different threads that we offer here at Vitality?
So here at Vitality, we offer several threads, mainly Pdo threads and then PLLA threads. So when you look at the threads, one of the things is what are they made of? And both of them are made of ingredients that dissolve within the skin. Pdo is called polydiaxone, and it's been used in sutures that have been used in cardiovascular surgery and in gastrointestinal surgery, where they want a slower dissolving suture because they don't want anything to break. These work great. They come in multiple sizes, and they come in different things called like barbs or cogs. They come twisted, they come smooth, and depending on what they are, like this is an example, and this is not a needle, this is a cannula. You can see it's dull, so we'll put a little hole in and pop the thread through, and this is an example of one that has a little barb, and I don't know that you can appreciate this thread, but it has little barbs that grab the skin, so when you pull, it supports the tissue, and then this stimulates a lot of collagen in that area and fibroplasia, which then holds the skin in place with the lift. These tend to last somewhere between 9-12 months. They also come twisted, and you can see here it's sort of twisted around, and this is on a little needle, and when it comes off, the thread itself is twisted. Let's see if you can see this little bitty thread twisted in the skin, and this works great in superficial lines. There's also a smooth that works well outlining the lip. We sometimes use those around in crow's feet and the tear trough as well. They also come in a longer smooth thread like this one, and the thread itself is smooth, doesn't have any of the barbs on it, as you can see, and we use this for neck lifts and face, and a different technique for lifting. These work well too. One of my new favorite threads is the Instalift thread, and this is an example of what Instalift is. It's made out of PLLA, which is the same thing that's made out of one of our biostimulating fillers called Sculptra, and it has little bitty cones on it. So what we do with this is we insert through, it's called a bidirectional thread. So we insert through one poke hole and then come out one way, insert through that same poke hole, coming out the other way. And then the skin is pushed along these cones and anchored in, and it gives a lot of lift. It continues to improve for up to 6 months, and because of the PLLA being a biostimulator, you also see improvement in the skin as well because it stimulates collagen. So basically, that's how the threads work, and the different threads. I oftentimes am using combinations where I use like 3 of these on each side of the face or in the neck, and then I'll tweak things with some of the Pdo threads in smaller areas, or if I just need a little additional lift somewhere. Other than that, that's about it as far as how threads go. I think there were a couple other questions.
Yeah, the follow-up question to that was, and can you also have dermal fillers after you have threads?
You can, and they work great in combination. I always say threads more lift the skin, and they lift some of the tissue, but they're not going to address any of the volume issues. I don't like doing them on the same day. I know some people will, but my theory has always been if somebody reacts to something, I want to know what it is. So if I do them on the same day, then I'm not sure what it is. I like to separate those treatments at least a week or two. So oftentimes I'll do your thread lift first, have you come back at your 2-week follow-up, and then we can look and see where some of the volume and additional lift and contouring needs to be placed. When you do that, oftentimes you need less filler with the treatment. So that's why I like to do the thread lift first. So keep the questions coming, and we'll keep visiting each week as we get new questions in. And so I look forward to talking to you all next week on Grace Talks.